afternoon, Professor and fellow medical students in this room. My name is Natrawee from Thammasat University. So this research is about the persistence of crystal identification in 2 weeks, frozen synovial fluid. It's done under Division of Rheumatology, Department of Internal Medicine, Thammasat University. For the background of this research is that crystal identification using polarized light microscopy is crucial for the diagnosis of gout and CPPD disease. But the challenges right now is that there's a limited access to trained personnel and equipment in rural and community settings, in which synovial fluid analysis is ideally performed within 24 hours to avoid leukocyte degradation and crystal dissolution. So this research tried to answer the research question that can crystals persist after 2 weeks of synovial fluid preservation in ether tubes at 4 degrees Celsius or minus 20 degrees Celsius. So for the methodology, we first do the joint aspiration from arthritis patients without knowing. We don't collect the clinical data of the patient. So we just get the synovial fluid sent to the central lab at Thammasat University from February to March 2024. Then we would have two expertise, which is rheumatologist and lab technician that would evaluate the synovial fluid, whether it's like MSU crystal or CPP crystal. So they would categorize them and see if there are presentation of the crystal at day 0 of synovial fluid joint aspiration. So this from the picture is in round 1, so it's at day 0. And then we would divide the MSU crystal sample and CPP crystal sample into 2 groups, which is 4 degrees Celsius and minus 20 degrees Celsius. And we would preserve it in 2 weeks. Then the round 2 of the experiment, we would use the same lab technician and rheumatologist. It would be a blind analysis, so they are not aware of the previous result. So they will see 2 things. The first thing is the whether it's MSU crystal or CPP crystal, and the other thing is whether it's still present in the polarized microscope. So as a result, for the MSU, for 4 degrees Celsius, the MSU is still persist for 78.6%, while in minus 20 degree is also persist in 71.4%, so about the same. But for CPP, unfortunately, is persist only 16.7% in both 4 degree and minus 20 degrees Celsius. So the conclusion is that for MSU crystal, is remain detectable in synovial fluid for up to 2 weeks, whether it's in 4 degrees or minus 20 degree condition, enabling reliable gout diagnosis. But for CPP crystal is degrade rapidly, so it's require immediate analysis or alternative diagnostic like X-ray or for CPPD. So to conclude, for example, if we analyze the synovial fluid, and if we don't detect the crystal identification, we can conclude that the patient doesn't have gout. But we can't conclude that the patient doesn't have CPP. Yep. Alternative diagnosis should be done. Yep. Thank you.
So thank you for the presentations. So did you explore more in terms of the like MSU crystal? So why the 21.4% and 28.6% degraded or disappear after 2 weeks? And also the same question for the CPP. Did you look why the CPP that persistent in both 4% and minus 20%? Why it's still present? Did you look back in terms of the number of the crystal at the beginning or any factors?
Yes, so they have lower number of the crystal from the beginning in both MSU persistent. So for the MSU, the baseline of MSU crystal is 14 out of 49. But after 2 weeks at 4 degrees and 20 degrees Celsius is decreased to 13 and 12. So just a little. But for CPP crystal, at first it's 6 out of 49 per high power field, and then it's decreased to 2 per 49 in both 4 degree and 20 degrees Celsius.
I'm just wondering about the concentration of the crystal that might affect the duration of the persistence. Not sure if you have any information about this.
Concentration, right? So for the exclusion criteria, we exclude the synovial fluid with 5 ml lower. Like if they have 5 ml synovial fluid sample lower than that, we would exclude it.
Like for patient with gout, they might have like the serum uric of like 10 or more, or like just 6, 7, and the higher, the more likely that it will remain there after 2 weeks. So I'm just wondering if like the more concentrate, the more likely that it will last longer. And the other point to mention is about your conclusion that you think the MSU crystal may be delayed up to 2 weeks, which is a bit scary for me because like almost a quarter of the patient will be misdiagnosed. Just to mention that. Okay.
Yeah, that's an interesting question to get research.